it's on record that over 500 million people globally have diabetes, okay? And like 10% of that number is said to be type 1 diabetes, while the rest of them, that's over 90%, is type 2. I felt I should discuss type 1 and type 2 diabetes differently, okay? I understand that a lot of people are confused about it, so it is better for me to discuss them, differently, okay? So that if you're watching a particular video on type 1, you know the in-depth, okay? You understand that this is type 1 diabetes, and everything we're going to be saying there will be, clear cut. But in the last video, we were able to summarize, diabetes, what the disease is all about, and how you can diagnose it, the symptoms, and all of that. Okay, so in this episode, we'll focus on type 1 diabetes, and then I'll do a separate video on type 2 diabetes, and then a separate video to distinguish the two. This will give you some kind of understanding on how these two conditions, even though they are the same, but they manifest in different ways. Okay, so they have them diagnoses and the same symptoms in terms of generally, right? But there are some specifics, when it comes to understanding, the nitty-gritty of each of them. Okay. So today we want to look at type 1 diabetes, and now type 1 diabetes, like we've been able to establish, is more of an autoimmune, syndrome. Like, what do I mean? It's a condition that just happens, where the immune cells attacks, the pancreas, the beta cells, which we know as the islet cells. These cells, they are responsible for the production of insulin in the pancreas. Okay, so what happens in type 1 is that for one reason or the other, which is still unknown, these immune cells attack, the pancreas, the beta cells in the pancreas. It attacks it and sees it as an antibody that is coming to harm the body. Okay, and when it attacks it, it destroys it, and this leads to the pancreas not able to produce insulin at all. Okay, so it means that this person would have to get an external source of insulin. Okay, so the person can be getting the medication right, can be getting the diet right, can be getting the lifestyle right, but because of insulin is not produced at all, the blood sugar will keep rising. Okay, now whenever the person eats, before you know it, blood sugar is skyrocketing. So that is type 1 diabetes. So this means that type 1 diabetes is kind of a permanent condition, right? It means that permanently the body will not be able to produce insulin, and this person would have to depend on insulin. That's why it's called insulin dependent diabetes, right? So now, how do you diagnose type 1 diabetes? And the best person to do all of this is your medical doctor. You must see your medical doctor to be able to do this, and it's best to see a specialist, an endocrinologist. That's a person to see. That person is specialized in issues that has to do with metabolic disorder. Diabetes generally is diagnosed in two ways. diabetes, right, in two major ways. That one is the fasting blood sugar, okay, which is not expected to be above 126 milligram per dl, okay, and this has to be consistent, for 2 to 3 times, okay. That the fasting blood sugar is consistently above this level, especially when the person knows that they are doing the right thing, right? And the second one is the glycated hemoglobin, okay, test, which we know as HB1AC, right? So this test is to check the amount of sugar in the blood for a period of 60 to 90 days. So it's more lasting, right? These are the two major ways to check for diabetes generally, like we discussed. But when it comes to type 1 diabetes, okay, there are three markers to check out for, okay. The first one is still the fasting blood sugar, okay. When the person checks the fasting blood sugar level, okay, now when this fasting blood sugar level exceeds 126 milligram per dl, okay, and another one is the random blood sugar level. Now when this person checks their random blood sugar level for 2 to 3 times consecutively, and it seems as if the random blood sugar level is above 200 milligram per dl, right, it is considered that this person might just be type 1 diabetic, okay. And then the final one is the glycated hemoglobin, right? If they check it and this person is above 6.5, okay, and all other symptoms that we'll be mentioning or we mentioned in the past, okay, is also present, it's assumed that this person is type 1 diabetic. So this is not to tell you that you're diabetic right now, okay. Don't use what I said. Like I said, I can always maintain, go to the hospital so that you will be diagnosed by the doctor. When the doctor diagnoses you, you will know if you're type 1 or type 2, right? How do you treat type 1 diabetes, okay? Now, you need to know that there's only a couple of ways to treat type 1 diabetes, okay? One is that because of the absence of insulin, from the pancreas can no longer produce it. It means that the insulin would have to come from external sources, and these external sources would be that you will be needing, insulin injection. Okay, for insulin, there are different types of insulin, which the doctor will determine if it's short chain or long chain or medium chain. Their onsets, they have their onset, they have their peak, and then they have the time when the duration they last. Okay, so these are some of the things that you will need to consider. Okay, insulin has the onsets when they start acting, and then they have their peak, and then they have the duration they last. So the doctor will determine which one is suitable for you and then prescribe based on that. And sometimes you can be given 2 doses per day, you can be given once per day. It all depends on how the condition, the doctor sees your own condition. So you have to prepare your mind to always inject yourself, and the doctor will always teach you how to do this, when to do it, when best to do it, and how to maneuver the puncturing, so that you don't use a particular spot. You can also use insulin pump. Okay, insulin pump is a kind of a device that you use to inject yourself. Insulin pump can actually be programmed, to always inject you with a particular dose, okay, in a particular time. So what happens is that your body has been monitored, and over time there is usually a specific time that your body needs insulin for it to metabolize, your carbohydrate and other things. So whenever it's that time, okay, your body, that device is programmed to release insulin, release insulin into your body, and then your body starts using the insulin. The doctor may also give you some medications around cholesterol, high blood pressure, and any other complication that may arise, because the truth is, type 1 diabetes, the complications are usually rapid because of the high level, especially when you're not doing anything about it. The complications are usually rapid. So it could happen so fast that you already have the complication. Okay, so the doctor can also give you other medications to take care of that. You also need diet. Okay, yeah, you need diet. I know that sometimes some doctors may see that it's not necessary but the truth is, type 1 diabetes, they need diet. Now, look at what happens. If you take a lot of insulin and your diet does not match the quantity of insulin taken, what will happen is that you may have hypoglycemia. And when you run into hypoglycemia, you have a lot of problems. Okay, you have a lot of problems for yourself. Okay, so it is important to know that diet is of essence. Now, there's one important point I forgot to mention. Okay, for type 1 diabetes, it usually starts from children. Okay, children between 4 to 14 years or thereabout. That's the early onset. But like I said in the last video, where I also told you that it can also come as a late onset. Okay, I mentioned the last time that it can also happen later in life. So you need to know which one. That's why you need a specialist to be able to look at you. Okay, so it's not something that if you just see any kid that is having some of the things I'm saying, you assume that the person has type 1. No, you also need to go to the hospital. Okay, so the doctor has more experience to look at these things I'm mentioning, and make an informed decision based on that. So you're not an expert to watch a video and then decide who is type 1 and who is type 2. Okay, so diet is of essence. Okay, you need diet to also control it, because the dose of insulin needs to match with the quantity of food you're eating. Okay, so as not to make you go low. Factors that affect type 1 diabetes. Basically, it's a genetic thing, right? It's been discovered that genetics is the major factor for type 1 diabetes. Now, however, there are other factors which are being considered. Okay, there are strong association with type 1 diabetes, which scientists are also looking at to decipher some other factors beyond just the genetics. Okay. Exposure to virus. Okay, in a review in 2018, a researcher found out that people that were exposed to virus were more prone to having type 1 diabetes. There was a strong association with people who had been exposed to some virus. Review in 2018 found out that mothers who were exposed to certain virus, okay, during their maternal, childcare period, okay, were predisposed to having type 1 diabetes. There was a strong relationship, in those people having type 1 diabetes. Okay, so it's one factor that is being considered, right? Another factor is environment, climate. Okay, some particular people in particular region are considered to be more predisposed to having type 1 diabetes. Okay, some of the regions are the Oceanic region, which people in Oceanic region, some people in Australia, and all of that, they have this, tendency of having type 1 diabetes. People in higher latitudes, okay, they were also found to be having, type 1 diabetes. People in areas with lower sun exposure, okay, people in areas where there are low sun exposure, okay. I think these are people in temperate region like Nigeria, okay. Other factors that are being considered is during gestation period and maternal weight, okay. Then the role of infant feeding is also a factor that is seriously being considered right now, and vitamin supplementation, and then finally maternal blood type. These are some of the areas that research are ongoing to discover if there are strong relationship with type 1 diabetes. Okay, symptoms of type 1 diabetes. Okay, there are basic symptoms which I explained in the last video, which I call the 3Ps. Okay, polyuria, polydipsia, polyphagia. Okay, you can go to the link. Okay, go to the description, you will find the link to the last video. I explained all the symptoms, and you will understand it better when you watch that video. Okay, so but for this one, there is also polydipsia, polyphagia, polyuria. Now for children, for polyuria, you discover that they will be bedwetting, okay, quite early, between that age of 4 to 14 years. They will be bedwetting, okay, serious bedwetting. So now you know that it's not every bedwetting that that just happens, right? That is a habit. So sometimes when the bedwetting gets out of hand, you need to go check that baby if they have type 1 diabetes, right? So, but this is when you need to go see the doctor. I'm not saying you should conclude at home. So go and see the doctor when you feel that the bedwetting is getting out of hand, right? Now, unexplained weight loss. Now, this is one of the very vital symptoms that you need to know. Okay, when other symptoms are there and then you discover that you're losing weight rapidly, with speed. I have one client who told me that he started losing weight all of a sudden. Okay, I discovered that this guy might be type 1. Okay, from all of the things he said, it was obvious to me because I've already planned my diet for him. I've already given him all that I needed him to do. I've told him what he needs to do in terms of physical activity. He told me his program. I mapped out diets tailored for him, and all of that. I did that. But he told me that he stays abroad, right? But I discovered that his sugar keep rising. And the fluctuations were 300, 200, and 150. It was just going crazy. And I called him. I told him, young man, I think I need you to go diagnose yourself again. Go to a medical doctor. Let them look at you. Go to an endocrinologist, okay, so that they will look at you and come out with a better diagnosis. And he went and they told him that you have to be placed on insulin. And he was placed on insulin, and with time his sugar started being normal. So these are things that many people don't get to understand, right? Sometimes the person just needs that extra diagnosis, even if you've done it before and it seems that the medication they gave you is not working. Go back and check. Go back to that person that diagnosed you. Go back to that place where you were diagnosed. They have your history and they will be able to re-diagnose you. And sometimes you're misdiagnosed. That is the intake. Most diabetic patients, some of them are misdiagnosed. Some of them think they have type 2, but they don't know that they have type 1. So it is best to go to where you can get, an adequate, appropriate diagnosis. And that's why I usually tell people, go to a public hospital when you want to meet an endocrinologist. Okay, go to a public hospital. You will have the best of them right there. A teaching hospital is appropriate. Okay, if you can get a teaching hospital that is good around you, it is best to go there. Okay, I know I'm not saying the privates may not have it, but if they have it, fine, you can go there. But most times, for affordability and other factors, I usually recommend public hospitals. Okay, the next thing is that you can have constant fatigue, tingling of the feet. Remember what we talked about, tingling and all of that, and the numbness. If you go to the previous video, you will see where we mentioned, some of these symptoms. And then mood changes. Okay, you will be having swift mood changes. So what leads to that breakdown, okay, of fat? You having a lot of loss of weight is what is called diabetic ketoacidosis. I explained it in the last video where I made you understand that it's one of the complications. It's one of the earliest complications of diabetes, especially for type 1. It's usually for type 1. It could happen in type 2, but most times it's usually for type 1 diabetes. Okay, so what happens is that your body starts breaking down fat as an alternative means of fuel because carbohydrates is not being metabolized. Okay, so the liver is activated to start breaking down your fat, and before you know it, you're lean. Okay, and all of that will happen, and then your sugar is also rising. So the symptom that you will know that you have this ketoacidosis, right? Fast breathing rate, fruity odor from your breath. When you breathe, you feel, there's this odor that comes, and then nausea, vomiting, dry mouth. So this is where we'll call it a day for this episode. I hope you got value from this video. I'd like you to talk to me, comment in the comment section, let me know what you think, and then like this video, share it. If you're not subscribed to this channel, I'd like you to subscribe and then click on that notification bell so that you'll be able to know when we release our subsequent videos. Okay, this is me, your dietitian Feji. I am signing out. I'll see you in the next episode. Thank you very much.